Good afternoon. So the study is therapy trial. It is a lutetium PSMA therapy versus Cabazitaxel in metastatic CRPC patients who have progressed after Docetaxel. This is the overall survival result after 3 years of follow-up. So this was an open-label phase 2 multicentric randomized control trial, and patients who are metastatic CRPC patients who have progressed on Docetaxel, rising PSA or a PSA level of more than 20 Ng per ml, and all patients underwent PET imaging and a PSMA PET. PS 0 to 2 patients were taken, and patients with FDG positive but PSMA negative, they were excluded. 291 patients were assessed for eligibility. 91 patients were excluded because of either low PSMA uptake or discordant disease or for other reason. 200 patients were randomly assigned to Cabazitaxel versus lutetium PSMA therapy. This is the chart showing what was total number of patients: 291, 91 were excluded, 200 patients were included for the random assignment, 101 allocated to Cabazitaxel, and 99 patients allocated to lutetium PSMA therapy. In the final analysis, they have taken 101 patients in the Cabazitaxel arm for analysis and 85 patients included for safety analysis. And in the lutetium PSMA arm, they have taken 99 patients included in the intention to treat analysis and 98 patients for safety analysis. This is median age 72 versus 71 year, median PSA 93 versus 110, disease sites, lymph nodes only, bone mets only, visceral mets. Visceral mets patients were only 7 to 13%. Previous treatment, most of the patients have also received either abiraterone or enzalutamide or both. So this is actually a third-line treatment, and Cabazitaxel dose was 20 mg per meter square, maximum 10 cycles, and lutetium PSMA therapy maximum for 6 cycles. The primary endpoint was PSA response, secondary endpoint was overall survival. This was the initial result published in 2021, 12 months PFS, PSA decline more than 50%, objective response rate. These all were higher with lutetium PSMA therapy, and grade 3-4 toxicities were 33% versus 53%. This is the recent update presented in ESCO 2023. Overall survival was analyzed by intention to treat and summarized by restricted mean survival time. So there were 77 out of 99 deaths in lutetium PSMA arm and 70 deaths in Cabazitaxel arm. This third group is the excluded patients, which was either initially they were thought for. Initially, they were included in the study, but they were excluded because of discordant result or two other reasons. They have also been analyzed for 3-year survival. So overall survival was same. The median survival was 19 months, 19.1 months versus 19.6 months. And these excluded patients, the median survival was 11 months only. So the conclusion is lutetium PSMA is a suitable option for patients progressing on Docetaxel. They have a higher response rate, lower adverse events, improved PRO, and similar overall survival as compared to Cabazitaxel. There is another study, which is phase 3 study, which was published in NEJM last year, Vision trial, that included patients. That was a comparison between lutetium PSMA versus the available standard of care. So there was no available standard of care at that time. The available standard of care was either bisphosphonates, denosumab, steroids, palliative care. So that study has shown a survival difference of about 4 months, 11 months versus 15 months, and that study included higher number of patients, about 800 patients. So these two studies, they conclude that lutetium PSMA therapy as a third-line treatment is a very good option. Thank you.